Hi everyone, my name is Bertram Sobolski-Hirsch from Fisk Software GmbH in Hagenberg, Austria, and I'm going to present a method for robust multimodal registration of cerebral vasculature. For our medical application, we are concerned with the fusion of angiographic and structural MRI in order to assess cerebrovascular disorders in the context of surrounding brain anatomy. Regarding the treatment of cerebral aneurysms, the gold standard modality for assessing the geometry of the aneurysm is digital subtracted angiography, short DSA. However, to determine the ideal access trajectory to the aneurysm, we require the tissue contrast of a structural MR sequence such as T1 MPRH or T2. In these modalities, the vascular contrast is compromised, which is why we are looking for a way to combine the angiographic and structural image acquisitions. Aligning the vascular structures in these images is challenging due to several reasons. First of all, due to the sparsity of vascular structures. For reference, less than 1% of the DSA scan contains foreground structures. The background varies significantly depending on the image modality, and we cannot rely on specific features to be present. The final challenge are significant differences in the physical extents of image acquisitions. For example, an average DSA scan has only 15% of the volume of an average MPRH scan. Current methods are inadequate for a task and will frequently fail to align such images. We tested state-of-the-art methods such as ANTS, Elastics, NiftyReg, and VoxelMorph to find that they fail for 75 to 100% on our clinical data of DSA and MPRH scans. While our specialized method of vascular registration, they do not support structural MRI due to the lack of an automatic segmentation methods and suitable features. Which brings us to a research question. Can vessels in angiographic images be automatically and reliably aligned with those in structural MRI? For our method, we formulate the problem as such. Given an image pair of a floating image I float and a reference image I ref, we're looking for a rigid registration method to obtain a resulting transformation TR that aligns both images. Here you can see the outline of our method, which we will further discuss. Starting with the input image pair, in our case the floating image is the DSA scan and the reference image the MPRH scan. From these images, we extract marks of the cerebral arteries. For the DSA scan, this involves segmenting the foreground using a threshold and connect the component filter. For the MPRH scan, we use a segmentation model Theta M for structural MR, which we trained using the NNUnit framework. We will provide further details on this model on the next slide. We convert these masks to point clouds, which we then register using our registration method Theta R. Our method uses the random sample, consensus, and iterative closest point algorithms to register both point clouds. In our figure, the DSA vessels are shown in green, while the MPRH vessels are shown in red. The registration yields a rigid transform TR, which we use to align both images. The figure shows the resampled DSA blended with the MPRH scan. Some details on a segmentation model Theta M. The model was trained to segment cerebral arteries and annotate the regions left, right, anterior, and posterior. We trained an NUnit model to segment any of the four modalities, which are time-of-flight MRA, T1, T2, and PD. For this method, we used procedurally generated ground truth based on time-of-flight MRA. While the method was not specifically trained on MPRH images, it generalizes well to the modality. More details can be found in our publication of the method and our repository, where we share the model and code. With this, we conclude the discussion of our method for a clinical use case of DSA to MPRH registration. However, our method can be easily extended to support a more general use case. We will further look at the registration of time-of-flight MRA to structural MRI sequences. This will slightly modify our approach by applying the model Theta M to both the floating and reference image, while leaving the remainder of our method unchanged. We evaluated our method on both clinical and public datasets, which we'll further outline on the next slide. Before that, we want to discuss how we acquired our ground truth elements. For this, we used the method ANTS for rigid registration. The results were manually screened to identify incorrect alignments. For any such case, we used 3D Slicer to manually obtain an initial alignment and again run ANTS with this input. When necessary, the process was repeated until an acceptable alignment was reached. To the right, we see visualizations of ground truth alignments for different modalities in our evaluation data. Our evaluation metrics comprise the translation error delta R, which is the offset in millimeters, and the rotation error phi R, which is the angular offset in degrees. We further defined an alignment success criteria epsilon R, which is true for a result where rotation error is below 5 millimeters and the rotation error below 5 degrees. The success criteria is further used to calculate the success rates as a percentage. We compared our methods against state-of-the-art methods ANTS, elastics, and nifty-red. We separated the evaluation for our clinical use case, where we registered DSA and X-ray angiography to MPRA scans, and the second evaluation of the public datasets ICSI and UTK, where we registered time-of-flight MRI scans to T1, T2, FLASH, and MPRA scans. Our clinical dataset comprises only 10 patients and 24 image pairs, while the public dataset comprises over 600 patients and almost 2,000 image pairs. We further considered two evaluation parameters, which we call size and setting, which we will further discuss on the next slide. These parameters were only considered for the evaluation of the time of flight to MR registration of the public datasets, and the goal is to compare the most challenging to the most ideal registration scenario. Concerning size, we are considering the physical size of the floating image. We compared the scenario where we used the originally sized time of flight MRA to the scenario using a crop scan. The cropping reduces the scan to one brain hemisphere, which augments a typical DSA scan extent. Concerning the setting, we consider the initial alignment of the image pair. In a global registration setting, we would typically discard initial alignment, which we do by aligning the geometrical centers of both images. In a local registration setting, we would assume a decent initial alignment and use it as input to the registration method. Note that while both parameters barely affect our method, they significantly affect image-based methods. With this, we are testing 4 different configurations for the time of flight to MR use case. We will first look at our results for a clinical use case. Left are the results for DSA temperature registration and right X-ray to MPH registration. Our method yields a 100% success rate and excellent offset results within an average of 2 seconds, while the compared methods largely fail after a long computation run. Looking at the time of flight to MR evaluation, our method again shows superior success rates and computation times. The compared methods were best in the local registration setting using originally sized time of flight scans, and worst in the global registration setting using crop scans, confirming our previous statement regarding the limitations of current methods. To conclude, looking at our research question, we can conclude that yes, it is possible to reliably register angiographic and structural images. Our method yielded a 100% success rate for evaluation data featuring almost 2,000 image pairs of 3 angiographic and 5 structural image modalities. Our approach used segmentation models to extract vessels in structural MRI, which are then aligned using point cloud registration methods. Our method outperformed compared methods in terms of robustness and computation time. Alignments are accurate with an average of 0.7 mm translation and 0.7 degrees rotation offset. This work is part of a collection of methods which we developed for the registration and segmentation of cerebral arteries. We encourage you to check out our repository where we share models and code for each of our methods. Our repository comprises our segmentation models for cerebral arteries and regions, 2 papers that we present at this conference, where the second one outlines an improved approach to segment detailed vessel trees in structural MRI, as well as our latest publication where we combine our registration and segmentation methods in an automated training framework. In future work, we will improve our work for cerebral artery segmentation by extending our registration method to nonlinear registration with the goal of improving the alignment of ground truth in structural MRI. Thank you for your attention.